The upper limb tension test with median nerve bias is a special test that can be utilized in a clinical prediction rule to identify cervical radiculopathy. In isolation, the upper limb tension test with median nerve bias is the most sensitive test that we have to date in order to identify or at least rule out and utilize as a screen for cervical radiculopathy. In order to execute the test, we want to ask the patient to assume a supine position initially, and we assess their resting symptoms. Assuming that our patient is currently complaining of radicular symptoms into their left upper extremity, we will then position the patient by bringing their glenohumeral joint up into about 90 degrees of flexion, pardon me, of abduction, and what we're going to do is we're going to block their shoulder girdle. At this point, we want to reassess for the patient's symptoms. If their pain is concordant and is becoming enhanced in this position, the test is positive and you are done. If not, and the symptoms have not changed, what we then do is we raise the arm into 110 degrees of glenohumeral abduction and maintain blocking the scapula. Again, symptoms are reassessed. If the patient does not complain of their symptoms or of their concordant pain, what we then do is we go into digit extension by placing the palm of your hand over the palm of theirs, and we move into extension at the elbow joint and extension at the wrist joint with full digit extension. We'll carry it all the way out. Again, it's a highly sensitive test and my patient is showing signs of apprehension indicating a positive test. If the individual had not shown signs of apprehension, we could carry the test all the way out as we had. I'll stop right here for my patient's sake. And we could create what we call a sensitization factor for this test. The patient would then side flex their head away from the arm that I'm testing, and if they were to be complaining of cervical radiculopathy, this movement would enhance their symptoms, and then they would come back to neutral, and if their symptoms were reduced, that too would be another indicator or a sensitization of this test indicating a positive finding.